With vaccination rates up and cases dropping, companies across the country are reopening their offices. And now many parents who want to go back to work are faced with a new problem, a childcare shortage. Treasury Secretary Janet Yellen says nearly 2 million women have not returned to the workforce because of caretaker duties, including childcare. Experts say the number of licensed childcare providers is down 13% since the start of the pandemic. The number of people working in the industry is also down 16%. And many childcare providers are reporting less than 60% of their pre-pandemic attendance. Joining us now to talk more about this is ProPublica reporter Lizzie Presser. Lizzie, thanks for being here. So first of all, help us make sense of the statistics. There aren't enough childcare workers, but then we're also hearing that there are less children in childcare right now. Help us understand how the pandemic affected childcare options in the U.S. and how it will ultimately impact our ability to return to some sort of normal.
Well, thanks so much for having me, Lana. As you said, we're seeing a drop of 13% in childcare facilities across the country. It's a huge drop. And on top of that, the childcare facilities that have remained open are really way below their capacity. It's really difficult right now to enroll kids, and it's really difficult to staff appropriately, to pay your workers appropriately. This is a childcare crisis that has been simmering for a very long time. In the past decade, we've seen 40% of home childcare providers shut down because there simply isn't enough money in the system. Then add on top of that the increased costs of keeping your childcare business afloat during the crisis, especially with so much shift in enrollment from kids and the difficulty of retaining a workforce in this time, when this kind of work is actually quite difficult to be exposed to kids and families every day. So what we are seeing is a dramatic decline in availability of childcare slots, particularly for working class mothers across the country.
And Lizzie, one of the things that I think is so important for people to understand about this is that it isn't just a problem that affects people who specifically cannot find childcare for their own families, but that it could have impacts for the nation's economic recovery. Can you tell us about that?
Well, of course. I mean, what we've seen, about 3 million women leave the workforce in the past year. And these women can't go back to work necessarily unless they can find childcare options for their children that they can afford. And so I wrote a story recently in Kansas City where I watched one childcare provider shut down and the ripple effects that occur when that happens. Some mothers who don't know who to trust once they have come to trust a single provider, don't know where to find another childcare provider, especially if they are working non-traditional hours. So I was writing about mothers who work at UPS, they work at Amazon warehouses, they are delivery workers, they are cashiers, they are nurses. They don't work 9-to-5 jobs. And so the difficulty of finding not only affordable and accessible childcare, but childcare that meets the rhythm of the modern workforce is really complicated and made far more complicated during COVID-19.
Lizzie, you're talking about how women are disproportionately affected. We also heard that from Secretary Yellen. Can you tell us more about how this problem is hurting people? Specifically, who is being hurt the most from this lack of affordable child care? And what can be done to resolve these main drivers behind the child care shortage?
So the costs of childcare have increased dramatically over the past several decades, and that's been felt across the spectrum. Working class families have felt it perhaps the most. I was meeting mothers who were spending up to a third of their income on childcare, even after government subsidies. And it's too much money to spend. One of the main causes of the shortage is just there isn't enough money in the system. This is a dramatically underfunded industry. So parents, even if their demand increases, it can't drive supply. That's a broken market. That is a failed market. So parents don't have the money, and the government subsidies aren't nearly enough to cover the costs of running a high quality and tightly regulated childcare business. What can be done? That's the big question right now. Biden has proposed what is perhaps the most ambitious reform since 1971, when a universal child care plan did pass Congress, but was then vetoed by President Richard Nixon. And Biden is attempting to outline a plan that would do a whole set of things for working families and for providers. One is it would cap costs at 7% of your income for middle and working class families. And once again, I was meeting families who were paying up to a third of their income on childcare. So a 7% cap is an enormous shift. He's also proposing to invest in the workforce, which is an enormous shift in this industry. This is some of the lowest paid work in the country. It's disproportionately staffed by women of color, and the vast majority of workers are women. A minimum wage of $15 is what he's proposing, and that would do an enormous amount for just developing a workforce in childcare, which right now suffers from extreme turnover. And he's also proposing subsidies that would actually cover the true cost of providing high-quality childcare, which is not how the system is set up right now. So those details are all still emerging, and it's unclear how much of that will be turned into law. But once again, it is easily the most ambitious reform in the past 50 years.
Still a proposal, but still yet to be seen exactly what part of that proposal will make it through Congress. Before I let you go, Lizzie, in addition to the sweeping proposal coming from the White House right now, last month, President Biden also announced the release of $39 billion for relief funds for the childcare industry to help right now. Can you tell us where that money is going, and has it made a difference?
Yeah, so a lot of that money is earmarked towards rescue funds for providers who have been struggling throughout the pandemic. Many providers have gone into personal debt just to stay afloat during the pandemic and to help support the mothers in their community who need this kind of care. So that money will go towards making sure that those providers are solvent, hopefully. One of the problems with that funding, though, is it's rescue funds. It is not funding that is meant to help states figure out how to restructure the child care system for long-term sustainability. And so while it is an incredible investment in this kind of care, it's a one-time injection. And so it will not do much in terms of restructuring how the child care system can grow and expand and provide accessible, affordable, high-quality care for families in the long term.
Lizzie Presser, thank you so much for joining us.
Thank you for having me.